Hello, my name is Bella Castellarin, and I'm an undergraduate student at the University of Nevada, Las Vegas. Today, I'm going to be introducing you to my mom, Krista Whitley, an NYU student. Can you tell me a little bit about your major and what you do in NYU's program?
So I am earning my Master of Public Health in Global Health, and I am really interested in the state of public health in low and middle income countries. So I knew when I started my college journey at the age of 43, I as well did my undergraduate at the University of Nevada, Las Vegas. We're based here in Las Vegas. This is Toothless, the cat, who also has been here through all of my academic journey. I did not start until I was 43. I knew after 20 years of being a CEO that if I was going to go to college, I wanted to do hard things in service of the community. So I did not have a lifelong dream of being a physician. I did not have a particular aptitude towards science and math. I actually physically sweat in every math and science class I've ever taken in my life. I work very, very hard. And I knew that if I was going to pursue something in academia, I wanted it to be something that would help those who are most in need, not just in my community here in Las Vegas, but also in the world. And so that is what attracted me to getting a master in public health, in global health. And NYU's program specifically appealed to me because they were doing work not just in the community, but they were also doing work around the world. And when I had spoken to other people who had earned their master in public health and had done public health work, they had these amazing stories of doing work around the world. They had been to sub-Saharan Africa. They had, been on the ground working with, mothers and children and directly making an impact on improving maternal and child mortality rates. And that sounded very exciting to me. And I knew pretty early on, I applied to 20 different programs and got accepted to all 20 and kind of narrowed it down to my top 5. And I sent an email on a Friday night at 7 p.m. Pacific, so it was at 10 o'clock Eastern time, to the top 5 programs. And I immediately received, within probably not even 10 minutes on a Friday night, I received an email back from Dr. Mark Jitt at NYU, and I knew that the program that I would be happiest with would be one that was going to be responsive to students, that was going to be very focused on collaborating with students, and the other 4 programs all took at minimum 3 or 4 business days. I'm sure they were very busy, but I was so impressed, and I proceeded throughout that weekend to go back and forth with Dr. Mark Jitt at NYU, who was just at that time stepping into that program. And I was so impressed by his real-time responsiveness, his genuine concern that I choose the right program, and his concern that I also understand all of the amazing things that NYU could bring to my education, that it made it abundantly clear that NYU was going to be where I would be pursuing my Master's of Public Health.
I love all of that. And you've had some really amazing opportunities with NYU. Can you tell us a little bit about what your experience has been, what the classes have been like, and the opportunities that you've gotten to go on now being with them?
So, my Master in Public Health Global Health program is online. And I wasn't really sure if that was going to be, when I started my academic journey, I started at the College of Southern Nevada, our little community college here in Las Vegas, and I was completely online. And, those classes, I would say, were a diverse group of people. Certainly not all eagles, some were pigeons. That drove me a little crazy, and I was really concerned about an online program being a bunch of pigeons where I really wouldn't be challenged and I wouldn't have authentic human connection. That is absolutely not the case with NYU's online program. My very first semester, I took data-driven decision-making in global health with Dr. Balaji, who I absolutely adore. He's already working in UNICEF, and we ended up with our group actually being published in the Journal of Global Health. We continued to work with him on research and refine what our project was. That was an incredible opportunity to really work on the front lines of understanding maternal and child health outcomes. Our country happened to be the Philippines. I have always wanted to travel to the Philippines. I still haven't had the opportunity. But I love that I've been able to actually really dive in and understand on a much deeper level and continue working with him above and beyond our fall semester. All through spring semester, we continue to refine that paper, that manuscript. We continue to work on that project as a group. Some of my group mates have since graduated from NYU with their Master in Public Health. They continue to work in public health. And so it's been an incredible opportunity. Additionally, above and beyond just the opportunity to publish in the Journal of Global Health and to work alongside these amazing leaders in public health, I had the opportunity in June to go to Zanzibar and apply systems thinking, which I had learned from Professor Chris Dickey over my spring semester. I had the opportunity to really apply those concepts from my course directly on the ground in field research in the most at-need villages in Zanzibar, and work directly alongside not just NYU students from other graduate schools, but also to work with UNICEF leaders, to work with the State University of Zanzibar, to work with Zanzibar government leaders, to work with other academics from throughout Africa. And it was my first opportunity to be in Africa. It was an incredible opportunity. I also was very lucky. There was a total of 6 of us from our online global health program who were there, which included, working, attending physicians within the NYU system who were students in my MPH program. That's incredible. I was worried that it was going to be pigeons, and instead, I have these incredible gastrointestinal surgeons who are not only in my program online, stepping out of the surgical suite to join classes, but who are going above and beyond and going and doing these classes in Zanzibar. So it has broadened my network. It has exceeded every expectation that I had hoped that I would have. And it has absolutely made me a raving fan of all things NYU.
I love everything about that for you. I am curious, now that you've gotten to go on these trips and do these projects with incredible people, what has that done when looking at global public health and as you're continuing your education? Because there's clearly a difference in when you're just researching a specific group situation versus actually having gotten the opportunity to be there and really make that difference one-on-one with those people and meeting with those officials.
So what's really great, and I think this is great about academia in general. I didn't know what public health was. I grew up with a mom who was an ICU nurse. My dad was a health teacher. So in some sense, sure, I knew, little bits from history, but I didn't really understand what public health people did. And I certainly by no means really understood the power of the impact that public health has in communities until I was doing my undergraduate work. And I took a Studies of Dangerous Drugs class at the University of Nevada, Las Vegas with Dr. Sheila Janofsky that changed my life. It opened up my mind to the impact that public health could actually have. And from there I was hooked. That was really where I said, okay, now I'm gonna get a minor in public health. I'm gonna pursue a master's in public health ahead of going to medical school. And so I think, what academia does, if it's done right and you are truly curious and you truly have a heart of serving your community and serving people, it just expands what you see possible. And so what my experience is at NYU, whether it has been in Zanzibar or publishing, it has opened my mind to opportunities not just for myself, but for my family, for my friends, for my community. It has expanded what I see as possible for humanity. And, a great way that it has done that is just, my daughter getting her undergraduate degree at UNLV, had no idea that, a big element of public health is in disaster management. And it was me sharing my experience in a disaster management course with Dr. Gershon, and my excitement for what the amazing impact that this could have for communities that really got you involved in public health and has helped many of my friends in my circle. I'm quite proud to say that I ended up being the catalyst for over a dozen different people in my life who have now gone back to college or started college for the first time in their 40s and their 50s. And I think that's really incredible because, accessibility to higher education has only become more challenging with the current administration. Funding for public health has only become more challenging with the current administration. And where I see challenges, I actually see infinite opportunities. And so I think we need to rely, we have a national shortage, an international shortage of caregivers, whether it is nurses, whether it is physicians, whether it is anyone, right, in caregiving. And I feel pretty passionately, as someone who has raised 2 children to almost adulthood now, that I think that gap can be filled by parents and moms who've been caregivers, a lot of us who maybe stayed home with kids or other people who had successful careers, having that amazing second symphony, that they can have in their lives in service to their community. Because I think we're all looking to have meaning and have purpose in our lives, particularly as we get into maybe that second section of our careers. And it's an incredibly rewarding opportunity for all people and all leaders and communities to have.
Very nice. I'm interested because you did mention that you've now gone back to college,
gone to college the first time.
Of course. And so what I'm curious about is, do you feel that you've really embraced it and everything that is now coming to you? Do you feel that the success is because you are much older, or do you feel that you just have a new perspective on all of this?
So I think for me, had I gone to college, I think in the traditional route, I probably would have gotten a business degree. I spent 20 years as a CEO and founder, serving on boards, serving on nonprofit boards. I always have had a natural acumen for business and for innovation and for problem solving. I certainly think that I am a more patient student, I would say, at 46 than I was maybe at 26. That's certainly accurate. And I would also say, it has planted a seed in me, not just to be a lifelong learner myself, but to inspire that commitment in my children, in their friends, in our friends, in our community. And it has really made me think about what my legacy will be long after I am gone, and how I can continue to fund, support, encourage, and inspire future generations of children to have that commitment to lifelong curiosity and the pursuit of education.
I am also fascinated. You have mentioned your 20-year plus career, and your connection to this community in Vegas is everywhere you look. I mean, you've really had quite an impact in this city. And so I'm fascinated, have you found any of those experiences to be advantageous in your public health work now? And what have you taken from that career into your graduate education and with your pursuit in medicine?
So, nothing is ever wasted. I think it's so interesting as an entrepreneur, the roller coaster of entrepreneurism, particularly when it lasted for me 20 years, requires you to always be an eternal optimist. Yes, things can go wrong, but everything can also turn out right, and it can also blow your mind and exceed all your expectations. And, as a whole, my 20-year career certainly exceeded my expectations. I would say that, I had no idea when I started my master in public health, or even when I started my minor in public health, it was really in that study of dangerous drugs course where I went, holy smokes. At the time, my last company was in the cannabis industry. And so I know everything there is to know about drugs and addiction and, every drug, not just cannabis, but, psychedelics and all of that. And I have such a passion for all of that. And I don't think that I quite connected that to public health until I was in that class, and I was like, oh my gosh, I automatically knew these statistics, I knew the research, I knew everything, and I was very passionate about it. At NYU, I've had the opportunity to work with Dr. Danielle Ompad and her lab, which is specifically doing research around cannabis and what have the public health implications been of the legalized industry, which is crazy because I spent all these years lobbying for us to have a regulated industry in the cannabis space, and now to actually really be part of that research and applying my skills. So I would tell you, nothing is ever wasted. The greatest failures I ever had were amazing lessons that were priceless. I feel no need to go get an MBA because I already have 20 years of doing that. And I think those skills and those lessons have only continued to improve me as a person and have certainly improved my experience in my Master of Public Health program at NYU. And I think ultimately will make me a better emergency room physician who is more empathetic, who is more patient, who is more dedicated to not only just solving the problem in front of me, but understanding the causes that lead to that problem to begin with, and then leading those solutions with empathy.
Very interesting. Do you feel as someone who is older going into education, and as you've mentioned quite a bit, the fact that you're going to be a doctor when you turn 50, and you're like, well, I'm going to turn 50 anyways.
Well, I hope I'm done by 50. It'll either be 50 or 51.
Truly,
but
truly.
Hey, I'll be 50 or 51 either way. I might as well get a new white jacket out of the whole deal.
Absolutely, absolutely.
Yes.
How does that make you feel going into the career? As you've seen with our administration, it has gotten much harder, and you did mention this, for public health it has gotten much harder for physicians to do their jobs. Do you feel that being an older physician going into this, that you have a little bit more leeway, or do you have any concerns going into what you're doing because of the difficulty that has come with this administration's decisions in your field?
So, I remember the days, and maybe this is, I think age and experience gives you a bit of wisdom. And I think certainly, I remember when we started lobbying for legalized medical marijuana in the state of Nevada. And, I remember when I moved to Nevada in the late 90s, it was a very red state. We are very purple. We have been very red, we've been very blue. We've really been, kind of back and forth. There is that constant tug of war. And so, for me, I think having been through what I have been through on, fighting very hard and advocating for patients' rights related to legalized cannabis use, it helps me to have a bit of patience around the current climate. I also realize that anything that I'm going to do, I want to have lasting, impactful change. And so I realize that it is a long road, right? It is 3 to 4 years of medical school. Hopefully I'm done by 50, 51. I will have at least another 3 years of residency beyond that. So, we're really looking at, 54, 55, right? A lot of my friends are maybe early retiring at that age. I already tried retirement at 40. It did not work out for me, so I'm going to stick with this. So I have to realize that, there's also going to be changes in the political climate in the United States and worldwide. That is going to ebb and flow. And, what I can do is share the knowledge that I'm gaining through my Master of Public Health and through my medical school education in the future, and share that with those members of my community so that I can be amplifying the message of what is really happening on the ground. And I think, it has been fascinating. It's led to some really fascinating conversations around the difference of what we're told in the media often, and then what I actually see happening in emergency rooms when I'm doing research or on the ground in Zanzibar. These are not problems that are multi-million-dollar problems often. In Zanzibar, our solution for our community required a budget of $500 USD. These are very achievable things that, when work together in collaboration with community and led by the community, are things that we can really solve. And so I think it takes something that feels impossible and makes it possible. And that's really what I believe in already for my 20-year career as an entrepreneur, and I certainly hope to take into my practice of medicine.
I love everything about that. I'm also curious because, as you've mentioned, you've gone back to school, but you've convinced dozens of your friends to go back to school. And right now, I have seen quite an increase in people going back to get that education. Do you think that there is a growing interest in the study of public health? And have you seen more people going into these programs? Because I will say, I know several people who have gone back and who are looking at global public health, especially because of our current administration. It's interesting, even though they made it harder, more people want to be a part of it. So have you seen this same increase in interest?
Well, I think, we have COVID a bit to thank for that, right? COVID, made hand washing and, covering your mouth and, in some sense, for people who genuinely are focused on solutions, COVID was a really great, big, hairy, audacious problem, right? And so, being a part of that solution, I think that's really great. I really firmly believe that I am the resistance that the current administration didn't see coming. I don't think that they thought that 20-year CEOs who were taking their companies public on the NASDAQ, who, had built their own businesses, I don't think they thought a bunch of white ladies in the burbs were going to decide to dedicate themselves to global public health and were going to dedicate themselves to the practice of medicine, specifically medicine, which is, the most at-need populace. I have no desire to work in my bougie hospital in my neighborhood. They're fine. That's not, my passion. I want to be on the ground working with the unhoused population. I want to be working with addicts. I want to be working in free clinics. That's the work that I want to do in my own backyard. Not only that, I definitely want to do, global emergency medicine in sub-Saharan Africa, in the most vulnerable populaces in the world. That's what I want to do on my vacation days. So I think what is inspiring to me is the amount of interest and the amount of passion that people have. And I think the best thing that we can all do is use our lives in a meaningful way. I think if you can do the hard things, you should do the hard things. I always heard, just because you can doesn't mean you should. I believe I will beats IQ 100% of the time. I have never been the smartest person in the room. I'm not a genius. I don't know that I'm going to solve cancer, maybe. Who knows? But I will tell you that I will outwork you every single day that ends in Y. And when you are on fire for something and you are living your best life in service of others, it blazes a trail for other people to dream bigger about their lives. And I have already seen that ripple effect that is started in my local community, and even in talking to your friends and some of your brother's friends, and about the choices that they're making, things they never dreamt possible. Just even me, going to NYU, oh my gosh, that's amazing, wow, and the amazing opportunities that I have had there. So I really think that in each of us living our best lives, in each of us daring to do audacious, big, hairy, cool things, that actually blazes the trail for other people and makes it all much more accessible. The current administration can do what it's going to do. As for me and my family, we're going to continue to do what we're going to do. And I hope along the way that, we have a few bold, relentless, dauntless leaders who follow along, and who live their best lives in service of others. And ultimately, I think that's how the world ends up becoming a better place.
Well, I'm always in awe of everything that you are doing, and it's truly incredible getting to have a first-hand experience and watching all that you work on. It has been an incredible honor being able to show off how amazing you are.
Okay, so I have a question. Before you wrap this up, you've done a great job, and I appreciate that. Mommy's very proud. Mommy hopes that Bella follows in my NYU footsteps, and we hope that she moves to New York in a couple of years herself. What is the greatest lesson that you have learned? If there's one nugget out there, and not everybody has, me on their couch or in their ear for, 18 years of their life, what if there's one lesson that I have given you, what resonates with you most deeply in your own journey?
I would say your life's message that you came up with when you were 14. The fact that we need more people doing what they do best, and that will always stick with me because it is the most accurate statement that I have probably learned in my entire life, and I am reassured that every single day we need more people who are doing what they are truly good at. And I love seeing when people who are skilled in whatever they're doing continuing to pursue that, because it only gets better. And I've really learned that through watching you. I mean, my goodness, you're incredible, and you continue to pursue what you're incredible at.
So, it's so funny. Okay, so what she's saying, this is my mission statement. It's tattooed, because I'm a gangster like that. It is, when I was literally a freshman in high school, I went to a tiny school. My graduating class was 60 people. I was also prom princess. and cheerleader, and got to do all the things, because when you're in such a small school, you get to do lots of leadership. And it is the world, we had to create a mission statement. And they explained to us what a mission statement and all that, my English teacher at the time did. And I remember on the notebook, really thought about what I wanted my life's purpose to be. And so I'll read this for you. This was what occurred to me at literally 14, 15, and has followed me through multiple careers, multiple iterations. The world needs more people doing what they do best. And where that comes from is I just thought to myself, what I do best is in helping others. I love helping people. I love people. I'm a people. I love to talk to people. I want to hear their stories, whether they are old, young, anything in between. I love hearing, what their lessons are. And, really a lot of those lessons have resonated with me. So I haven't had to touch the hot stove, thank goodness. And I really loved, just that driving. And so when you look at my life, it looks like this crazy amalgamation of, working with Snoop Dogg and, doing crazy things in cannabis and, being on reality TV and all of these like amazing, crazy things that make absolutely no sense. But really, when you put it in the context of helping other people to do what they do best, isn't that the mission that we should all have? Right? Whether you're undergraduate, graduate student, whether you've never gone to college at all, that if you told me 10 years ago that I would ever go to college, I remember giving a keynote speech at Women Grow in Denver, Colorado, where I said college was a waste of time for leaders who wanted to innovate. I mean, the hypocrisy is rich, right? And it is. Truly, if you want to go and break things, you don't need to learn about that in a business class. Business school can be great if that's the skill set that you need. But I do think that a lot of people waste their time trying to find themselves in a business class. You're not going to find yourself in a business class, For any of us who've done it for any length of time, you find yourself going out, doing cool stuff, right? Being with people, hearing their stories. That's the magic of the human experience. And so, I certainly hope that if my life has inspired you or your brother or people in our lives, that is very rewarding for me. And so I love, great answer, kid. Great answer.
Thanks.
Awesome. Thank you for having me, and go Violets, NYU.
Well, thank you for being here.